afternoon. It's Cathy Mellett and Dr. Sanjay Govind. I come to you from Enough, and Sanjay, if you'd like to introduce yourself.
Hi, I'm Sanjay Govind. I'm an urgent care physician working in Auckland, and have the luxury and privilege of working with Cathy.
Awesome. So what we're going to talk about today is self-image and where self-image has moved to over the last couple of years, and what Sanjay is seeing in terms of patients that he assesses and deals with. So Sanjay, do you want to talk a little bit about self-image?
Self-image over probably the last decade, with the advent of social media and the applications like Instagram and Facebook and Snapchat, have allowed the vast majority of the population to now portray themselves on social media. Years gone by, where it was only the magazines like Vogue and so on that would portray beautiful models with beautiful bodies. It's now everybody on social media who has managed to Photoshop themselves into looking like a supermodel. So this then reflects upon the rest of the population not being adequate enough, and so we are seeing a large insurgence of patients with body image issues, with lots of detrimental effects on both from a mental and a bodily perspective. Dieting has become a big issue. Different types of diets, the keto diets, starving patients themselves. So it's lots of issues around this that's created bodies that seem to be perfect, but however unfortunately are taking a toll on the way they view themselves, both from a mental perspective and body shape.
Almost unrealistic body images. So you see things and there's no way that your figure that is an hourglass will ever get to be like that particular image, but you're driving towards it. So Sanjay, if that's what you're seeing as presenting, what do you believe your recommendation is to people? Because what you're saying is a reality.
That's true, and the issue is usually that the patient themselves don't perceive this as something that's unreal. They perceive it as reality, and in their perception that it's reality, they then strive for this, and so the rates of anorexia and bulimia start to increase, body image issues start to increase. And I think it's a difficult conversation to have with certain patients, because that is their perception that this is what is out there is reality, and what they see themselves as is inadequate. I think if one took a step back and looked across the board, and you see the different shapes of shapes of people around, one would realize that the world is not filled with supermodels, and it's not filled with the hourglass body itself, but with reality of the situation, which is we all come in different shapes and sizes, and as long as we can respect our bodies and respect our minds, we will be fine.
Absolutely, and I would perhaps suggest that if anyone is feeling like their body image is not what it should be, and it's becoming an alarm to that person or alarm to their friends, do you have any suggestions for that?
Once again, I've always reiterated the point that seeing your family doctor, the person that looks after you on a continuity basis, is the person to see. They're the ones that know you from time gone by to right now. They're able to follow you up and look after you and afford you all the care that you require. There are also other organizations that are out there that would help with any type of crisis component, which is your urgent care physicians, the helpline, and as well as the CAT team, which you can easily access online.
The CAT team?
Yes.
C-A-T?
T. It's a CAT team. It's a crisis team.
Okay, perfect. Absolutely. So Sanjay, once again, thank you very much for your valuable insight. I think that what our GPs are seeing and our aftercare emergency centres are seeing is a real trend, and I think that's where I'm Enough comes in. It's about acknowledging that it's there and trying to put some of these things that we are doing ourselves into perspective. Are we protecting ourselves or positioning ourselves against something that's real or not real, and can we really achieve what we're trying to achieve? So once again, Sanjay, thank you very much for your input, and it's back to you from I'm Enough.